down in Santa Rosa, maybe a good idea is Old Red and Mark West Frank. They'll basically come out.
Sheriff's office! Come on!
Oh, she's disabled.
All right, let me get her feet.
Her husband's right behind you.
You gotta go! Sonoma County Sheriff's Office, this is a mandatory evacuation order. Leave your homes. Go! Go! Go, 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 go!
The night of the fires, I had to leave my home unexpectedly, thinking we could be able to return at some time.
There was smoke in the house, and I could smell it.
One day everything is normal, and the next day everything is changed, and I don't know how long it will take this community to feel normal again.
As I got outside, there was ashes everywhere. I couldn't believe my eyes. What had happened to Santa Rosa? I still didn't expect my home to be completely gone.
You don't think about your house burning down, not in a residential area. And when I saw the fire happening about 6 houses down, I thought, well, the fire department will come and they'll put it out. It's not an experience that's normal.
One of the couples that lived in the near Fountain Grove area lost their home. They were walking up our courtyard and they had 2 little shopping totes and neither one was even full. And that's all they had.
Our son is graduating high school, and I'm working tonight on making a photo collection for his grad night. I did grab one kindergarten photo as I ran out the door. That is my childhood photo of my child.
When you think about recovery and resiliency building, you know it's going to be a long time for the people of Sonoma County to really fully heal from the wildfires. But what you don't think about is how it's affected even people who didn't lose their homes in the fires. The work of the Healthcare Foundation in mental health has covered a lot of landscape this year. We've got mental health programs that we're funding in the schools. We've got mental health programs to bring additional mental health professionals into our community to make sure that our bilingual and bicultural community members have additional access to mental health services. The biggest project by far is our Wildfire Mental Health Collaborative. And in that collaborative, we've created mysonomastrong.com, which is a website that anyone in the community can go to assess their level of angst and to find some coping strategies to help them. We've got drop-in counseling sessions. We've got one-on-one counseling sessions. And all of these things are underwritten by very generous donors who really understand that a part of putting community together is taking care of mental health first.
We are really dedicated to making sure that the underserved and underinsured have access to health care.
Another strength of what we're doing in Sonoma is program evaluation. We need a kind of accountability in disaster mental health response. We call that measurement-based care, and it's going to make mental health services more effective.
There is still a stigma that stops people from reaching out to get help for mental health problems.
There's 56% of people are exposed to a traumatic event in their lifetime, and what we know is that 8 to 20% go on to develop PTSD.
So people always ask me, what is this collaborative and who's involved? And I'm really pleased to say that it's lots of different organizations. It's all kinds of organizations coming together with the idea that if we work together, we can truly create an interconnected web of mental health services that are provided for free to everyone.
This has been personally very important to me because this is my community that I love.
This disaster has affected our entire community. We all know someone who lost their home or lost their job or lost their industries.
And then there's the fact that what we're going to do, I see the benefit for our community, and I think that this is going to really pay off in leaps and bounds.
It's an outpouring of caring and kindness and wanting to make sure that everybody has access, regardless of whether they can pay for it or not, regardless of whether they're an English speaker or not. And this is not about therapy. This is about finding within the resources to help yourself heal from a traumatic event.
The collaborative to me is presenting an opportunity for Sonoma County to educate potentially the rest of the country and beyond as to how to make their way through this kind of an enormous disaster. And that is an opportunity that does not come along very often.